Thank you, Gerard. Good morning, everyone. Welcome to the Legislative Council Chamber of Parliament buildings. Can I acknowledge the presence of my parliamentary colleagues and all of you who've come to this important gathering. It's appropriate that it takes place, in this room, today. And I acknowledge all of you for what you will contribute. One of the things I want to say right at the beginning is it is very easy to point the finger at young people as having a range of problems and a range of issues and sort of imply that somehow they are part of that problem in terms of their cause. And I think we've got to be very careful when we discuss the real challenges that they do face, that we do so in a way that actually is tolerant and open and respectful of them as individuals. It is too easy to blame young people. They're all the same. They get up to these terrible things, woe, etc. It's also, in my view, too easy to try and compartmentalise what the issues are. They drink too much. They indulge in unsafe drug practices, or whatever it might be. The reality is, and what I think the value of today's seminar will demonstrate, is the interconnection of all of these issues. And the representation that's here demonstrates that you are looking at the totality of the person and the interconnection of the issues and the challenges that they face. So it's not a question of isolating out particular issues, it's a question of working constructively across the board. And that's why I think it was very important that the Mental Health Foundation support this program. And Lynn, I acknowledge your work both previously and now in an ongoing sense in that development. From the government's perspective, that same interconnectedness applies in terms of the response that we have been taking over a period of time through a range of strategies. We have the Prime Minister's Youth Mental Health Project, the Drivers of Crime Project, the work on vulnerable children, the development of youth forensic services, the implementation of the new mental health strategy, and more latterly the Suicide Prevention Action Plan, the initiatives that have been taken through Whana Ora, and various impacts of the welfare reforms. They all interrelate, and they're all part of a complex jigsaw of responses to the range of issues that we face. Alongside that, we have given very clear direction to district health boards in terms of our expectations for them with regard to alcohol and other drug services for vulnerable young people. And we've asked all of them through their district annual plans to identify the steps that they're going to take to improve services in this regard. The next level of intervention is at the work of the non-government organisations, the NGOs. I am a very strong and passionate believer in the commitment, the dedication, the enthusiasm and the impact that the NGO sector can have in delivering quality outcomes. In the mental health space alone, we have over 300 separate NGOs active. They are a very strong complement to the work that can be done through the DHBs and the government side of the equation. And I think we've got to move away from, and many of you will have heard me say this many times, the notion that the government sector provides and the NGOs are merely there to fill in the gaps. This is a much more collaborative approach. It's got to recognise the particular skills of particular organisations best equipped to provide the appropriate response in the circumstances. And I think that the level of representation here today demonstrates that you're up for that challenge, and that's good. For its part, the Ministry of Health is working collaboratively alongside you in a variety of ways. It's important that we remove access barriers where we can, for example. And I must say, in the services that I've had the privilege of visiting and the time I've enjoyed with you, that real commitment to openness, to a customer-focused environment, if you like, is evident. It's different in different places, as it should be. It's much more responsive to local needs, as it should be. It's culturally responsive and sensitive, as it should be. And it's bringing together, in many senses, multidisciplinary approaches that get away from that compartmentalisation of the problem, but look at the totality of the issue faced by the individual who's on the other side of the table or the other side of the room. And one of the challenges as we move forward in this whole environment, where there are so many pressures on young people from so many different sources, has got to be to make that access as friendly, as open, as easy as possible. I said last week at a forum that was held at Government House on the Suicide Prevention Action Plan with particular regard to Maori initiatives, that the first step is to start talking openly. The first step is to start addressing the reality of what the problem actually is, not what we might think it to be. And with the range of alcohol and other drug addiction issues facing young people, I think that step is true too. What is the actual issue? What are the needs? How can they be best addressed? Who is best placed to meet those needs? That's the type of approach that I think is important to take. Now, it's a combination of the official agencies, the NGOs, good clinical practice in both, proper research, good advocacy, and fundamental sympathy and understanding of the issues that we face. In this respect, I think that NCAT plays a particularly valuable role. And Robert, I acknowledge you and your team, not just in Auckland but across the country, for all that you do in this regard, and for your ongoing understanding, empathy and energy in this event, in this field rather, and in fact for your organisation of this event today. So I look forward to hearing the outcome of your deliberations. I look forward to continuing to work with you on the range of issues that you're interested in. And I give you a commitment that we are determined to work collaboratively across the board in the most appropriate way possible that we can to interconnect all these services and to ensure that at the end of the day, the work that we do with regard to young people will make a difference in their lives. We'll not put more barriers in their place, but we'll make a positive difference in their lives. Funding is important, so too is commitment, enthusiasm and cooperation. So can I welcome you again to the Legislative Council chamber, wish you every success in the day's deliberations, and mysteriously and magically, as I've spoken, Grant has materialised. He can assume the platform in a moment and kick the day off with his keynote address. Good luck, and thank you very much for your attendance.